Hello everyone. Today we shall be discussing an important health concern that is known as hypertension. Hypertension, you all know, it is also known as a silent killer. Why? Let's see. It is a public health challenge worldwide because of its high frequency and concomitant risk of cardiovascular disease and CKD. We have already discussed kidney disease. We know cardiovascular diseases. So all of them, they are affected by hypertension. As hypertension is a symptom, not a disease, it delay in its proper management can cause many can help us in delaying many degenerative diseases, including coronary heart disease, end-stage renal disease, then peripheral vascular diseases, and overall mortality. Hypertensives, when compared to normotensives, normotensives are people who do not have high blood pressure. They develop twice as much coronary heart disease. That means they are twice at risk as compared to normal people, and they are 4 times as much at risk of congestive heart failure, which we shall be discussing. And then they are 7 times more prone to stroke, that is paralysis. So, how do we define hypertension? Hypertension is high arterial blood pressure. There is more blood pressure in the arteries. And how to define it? When the systolic blood pressure is above 140 millimeter of mercury, and or diastolic blood pressure is above 90 mm of mercury. So this is a range which you can see in the slide. We see 120 by 80. That is the ratio of systolic and diastolic blood pressure that is considered normal. And 120 to 129 if the systolic blood pressure is, and the diastolic blood pressure is 80 to 84, we term that person as normal but in pre-hypertension stage. And if that ratio raises further, 130 to 139 is systolic blood pressure, and up to 89 diastolic blood pressure, we call them borderline hypertensives. And then if it is more than 140 by 90, then it is hypertension. And now after that, if the BP raises further, we can divide them into 3 categories. First is up till 159 and diastolic till 99, they are stage 1. If the range is 160 to 179 and the diastolic blood pressure is 100 to 109, then we term them as stage 2. And if it is more than 180 by 110, we call them severe hypertensive. They are stage 3. Now, can we classify hypertension? Yes, we can classify hypertension into 2 parts. First is known as primary hypertension. It is also known as essential hypertension. And here we do not have any underlying disease. Many a times we do not know what is causing the hypertension. So such type of hypertension is known as primary or essential hypertension. And the examples are benign hypertension or malignant hypertension. Malignant means cancer causing. Then secondary hypertension is the other class. Here the hypertension occurs in addition to or as a result of some other problem which is there inside the body. For example, cardiovascular hypertension. If the person has some cardiovascular issue and that causes hypertension, that is one example. Then endocrine hypertension, when there is problem related with the hormones. Then renal hypertension, then neurogenic hypertension, and then pregnancy-induced hypertension. They are the other examples of secondary hypertension. Now, let us see what is the etiology. What causes hypertension? The exact cause, as I have already discussed in the primary hypertension, we don't know what is the exact cause. But there are many conditions which are associated, which are found to be associated when a person becomes, or once a person is identified as hypertensive. For example, genes. If both the parents are hypertensive, then there are 45% chances that the offspring will be hypertensive too. And if a single parent is hypertensive, then these chances are 25%. And then stress and aging. If the stress increases, once the age increases, uh, the person is predisposed to hypertension. Then some lifestyle factors like smoking, alcohol, and then tobacco consumption, they are also found to be associated with increased prevalence of hypertension. Then obesity, diabetes, adrenal and thyroid problems, and then CKD, sedentary lifestyle, and physical inactivity, they are important factors which cause hypertension. Then there is high level of salt intake and low level of other minerals, there calcium, potassium, magnesium intake. Then if a person is having vitamin D deficiency, and if the person is on some drugs which contain high amount of sodium and which can cause some imbalance between the sodium and potassium level, that can also predispose a person to hypertension. And now these are the risk factors arranged in a pictorial form. There are few changeable or modifiable hypertension risk factors. For example, if we can control overweight and obesity, if we can see that the diet does not contain much sodium, and then alcohol, then physical activity, if we can increase, if we can cease the smoking, and if we can control the stress, these are the modifiable factors. And then there are few unchangeable factors which are non-modifiable factors. They are aging, then certain races which are more prone to hypertension, then family history, we all know, then gender, males are at risk. They are more prone to hypertension when compared to females because of hormones. And then if the pre-hypertension or the gestational hypertension is there, that cannot be modified. Now, what are the consequences of hypertension? What are the major effects of hypertension? Now, as I have already told you, that it is also known as silent killer because the symptoms are not that obvious. Many times you will not know whether you are hypertensive or not. So there are many kind of complications or the consequences which are related to the hypertension. It affects the heart, where it can cause left ventricular hypertrophy. That is the left side of the ventricle, left ventricle, that will become large in size. And then there is coronary heart disease, and then it can cause heart failure too. Now, how it affects kidneys? It can cause kidney failure. Then it can cause PVD, that is peripheral vascular disease. Peripheral vascular diseases are the diseases of blood vessels which are supplying blood and nutrients to our limbs, that is your arms and the legs. And then it can cause retinopathy, that can harm the eyes. And then it can affect the brain. It can cause transient ischemic attack, that is known as TIA. That means a short clot, when it reaches the brain, it causes partial paralysis or a full stroke. That can also happen. Now, what are the symptoms? As I told, many of us, we will not know whether we are hypertensive or not, because many times it does not show any symptom. And but some of them could be, a person may feel headache, it could be shortness of breath, or some dizziness, fatigue, chest pain. And then in severe hypertension, epistaxis, that is the blurred vision, that can also be caused. Then palpitation of heart and nosebleeds are also some of the clinical manifestations. Now, this is can we prevent hypertension? There are few modifiable factors which we can control sodium intake if we can do some regular dietary exercise regime, if we can practice less fat intake, and then if we take less refined sugar, and if we can control the alcohol and cigarette consumption. So there are few factors which we can modify, and we can try to prevent hypertension. Now, the treatment and management, here we have to pay focus on three things. The first is food, second is habits, and third is lifestyle. So, what are the objectives of nutritional management? They include to achieve gradual weight loss in overweight and obese individuals. Even if the normal person reduces some weight, it will definitely benefit the hypertension. And then to reduce sodium intake and maintain fluid and electrolyte balance. That means the balance of sodium, potassium, calcium, and other vitamins and minerals that helps in hypertension. And to maintain adequate nutrition and to lead a healthy lifestyle, no smoking, alcohol consumption, but a high physical activity, and to slow down the onset of complications. So these are the objectives of nutritional management. Now let us see what do we do about the energy. Excess calories through fats and carbohydrates, they should be reduced so that weight is maintained. And many a times we give a person, we suggest him to take reducing diet, low calorie diet, so that he can reduce approximately 5 to 10% of his weight. Then proteins, normal protein contributing 15 to 20% of total energy needs to be recommended. Red meat, egg yolk, they could be avoided as it has a great proportion of saturated fatty acid. So these are a few advisories. Then fats, the fats incorporated in diet should be rich in unsaturated fatty acids and should not provide more than 20% of the total calorie. So now we have a breakup of approximately 35 to 40% of total calories, where 15 to 20% of the calories they are coming from the proteins, and then 20% are coming from the fats, and then comes to the rest of 60%, they should come from the carbohydrates. And here we have to focus more on complex carbohydrates, so that there is these simple sugars, they do not increase the sugar level inside the blood immediately and put more pressure on the arteries. Then minerals and electrolytes. Mineral and electrolytes of clinical significance, they include calcium, sodium, and potassium. So here calcium, we have to maintain adequate calcium intake. It is an essential part of treatment. Then sodium restriction along with weight reduction, as I have already discussed, it helps in controlling mild to moderate hypertension. Here 1 to 2 grams of sodium is recommended per day. We all know that 1 teaspoon that contains 6 grams of sodium chloride, and that is equivalent to approximately 2400 milligrams of sodium. So here we are recommending approximately 1000 to 2000 milligrams of sodium. That includes approximately 3/4 to 1 teaspoon of salt per day. Now, depending upon the severity of the hypertension, different levels of sodium intake they are recommended. Usually, for the mild sodium restriction, 2 to 3 grams sodium is allowed. Here, 1 teaspoon, as I told. The salt may be used lightly in cooking, but no salt on table is allowed. Now, moderate sodium restriction, that is 1 gram sodium. Here, no salt during the cooking should be added, and vegetable with high sodium content, they are also limited. Now, which are the vegetables which have high sodium content? Usually the green vegetables, they have high sodium content, and then milk also contains sodium. So here, once we are focusing on the sodium restricted diet, now we pay attention to the specific foods which contain high sodium level, and we need to count them while making diet plan for such patients. And then comes stricter sodium restriction, that is 0.5 gram of sodium, and then comes severe sodium restriction, that comes 0.25 gram sodium, but they are quite rare. Now, this is an example of low sodium diet where we are giving 0.5 gram of sodium. Here, what are the foods which are avoided? We avoid table and cooking uh, uh, salt, and then we avoid bakery items also, because that also contains a lot of sodium. And now, bread or chapati or wheat, rice, maize, jawar, bajra, ragi, breakfast cereal, pulses, fish, chicken, milk, then vegetables, potato, sweet potato, tomato, gourds, and cauliflower, cabbage, carrots, they are all allowed. They are allowed in this kind of diet. Now, potassium. Potassium, as I know, that the total relationship between the sodium and potassium, that has to be maintained for the control of hypertension. So, increasing potassium content lowers the blood pressure and hence improves the hypertension. So, this can be done by increasing fruits and vegetables in the diet. Then, fluid restriction is necessary only when there is edema which is present. Now, lifestyle modification, as I have already discussed, weight reduction is needed. Try to maintain the good BMI. Then there is dietary approach to stop hypertension. We call it DASH diet. I shall be taking up in the next slide. And then we have to restrict the sodium. And then we have to increase the physical activity. Here we say one should go for minimum 150 minutes of exercise per week. That should be the moderate intensity exercise. And then alcohol consumption has to be regulated. So this was the DASH diet which I told you. And what is the DASH diet? Here the food group, especially grains, they include 7 to 8 servings of grains, and then 4 to 5 servings of vegetables, and similar equal quantity of fruit serving they are added, and it includes low fat milk, 2-3 servings, and then it contains meat, lean meat, that is 2 or less servings of that, and it contains nuts and legumes, that is 1 to 2 servings of nuts and legumes. So these are the major components of DASH diet. That is the dietary approach to stop hypertension. Now, for general awareness, as I would like to highlight, hypertension is a silent killer, and as most of the patients, they are accidentally detected once they are admitted to hospital for some other kind of problem and under-related disease. Now, or the pre-operation checkup, they come to know that they have hypertension. And many patients, they are diagnosed when they seek medical advice due to some kind of organ damage, because they do not know, it does not have very obvious symptoms. Now, hypertension awareness, treatment and control status is low, and only half of the urban and quarter of the rural hypertensive individuals, they are aware of its presence. Rest, they do not know if they have hypertension. So hypertension is asymptomatic. BP measurement is essential. We should measure it, and BP reduction is required once we are detected hypertensive. Drugs, they are effective, safe, and well tolerated, and required to be taken for life, even when BP is